For the past 10 Sundays during this pandemic, we have been checking in with Emily Allen, a critical care nurse on the COVID ward at Bethesda Hospital in St. Paul. And we're doing that again this morning. Take a look. And joining us right now is Emily Allen. Emily, thank you so much for your time again.
Yeah, thank you.
Before we came on here, we were talking, and you said that you were hoping to have a weekend, a few days off, but they keep calling you, the hospital keeps calling you. Why is that?
You know, this just isn't a Bethesda thing. It's the entire state of Minnesota that is being called. The ICUs are very, very near capacity throughout the whole state. And our staffing, like every hospital, is being stretched very, very thin right now. So they are very much in need of help.
So all the nurses that are doing COVID cases are getting called constantly?
Correct.
All right. We did a story this past week about a gentleman who was in a COVID ward, not in Bethesda, but he'd been there for 50+ days. Mm-hmm. Is that common? Because in these days, it seems like nobody is in a hospital for 50 days.
You know, I think 50 days is a lot. I would say for these people that are usually on the ventilator, and I can't speak for every particular patient because everyone's different, but, you know, we're seeing these people nearing 2 weeks on the ventilator alone. And then, you know, it's a long recovery process. You've been in a bed for 2 weeks. You've been on medications to sedate you. It's a long recovery road. They have to do physical and occupational therapy. They have to work on getting their muscle strength back. So, you know, 30 to even 50 days, you know, that doesn't surprise me that person had to go through that. It's a long road to recover.
And let me ask you, in terms of mentally, how are these patients doing? Because that's a big part of any recovery. I mean, it's got to be tough.
It is tough. You know, these medications that we put these people on to sedate them so that we can get them to breathe adequately, get their lungs to do the compliance that we need them to do. These medications put people out. A lot of people don't remember, days go by, and when they wake up, it's kind of scary for them right away because they're kind of like, well, where am I? You know? So on top of that, you have to try to get your mind focused back on where you are, what happened to you, and then you have to start to try to physically recover on top of not seeing or talking to your family for however long you've been there. It is a lot for these people.
And one thing I've read is that even when they come out of it, some of these patients can relapse. I mean, is that common?
You know, I can't say it's common, but, you know, we have to, at Bethesda, keep a few ICU beds open in case patients from our medical floor need to come over and be intubated as well. So it can happen.
Swing back. One of the hearings that I listened in on this week was a hearing where nurses described why they're going through so much personal protective equipment. They said to turn someone over on their stomach, which you have to do to help them breathe, sometimes can require 7 people that all need PPE. Can you just explain that and how is the PPE supply going for you?
Exactly. So we do what you're talking about is proning somebody, and we flip them on their stomach, which allows a break for their lungs, and it allows their lungs to expand more so that they can get more oxygen. So when we do that, it is a very, very technically careful procedure. We have to be extremely careful. Number one, when you're flipping somebody, you know, you have to remember they have that ventilator in their mouth, the tube down their throat. So I shouldn't say ventilator in their mouth. They have the tube down their throat. And we are very concerned when we are moving them so much that it could become dislodged. So yeah, we usually do 7 or 8 people. You know, there's probably 6 nurses. There's the respiratory therapists who I don't think get enough credit for what they do. They are unsung heroes of this pandemic for sure. And then we have a doctor in the room as well in case that tube did become dislodged. So think of, I mean, that's 8 masks that we're using, 8 face shields, 8 gowns, 8 sets of gloves. So yeah, it is a lot of stuff, but it's what we have to do. And that's kind of the bare minimum we need to safely do this procedure.
All right, Emily Allen, it's always a pleasure. You've been so great in sharing your story and your journey. We appreciate it, and I hope you do get a break and some time to yourself and for your family this weekend.
Thank you so much. And please just continue and don't be apathetic with the fact that we're starting to loosen restrictions, because this is real. So thank you so much.